Hello, my name is Paul Geiger, and I'm the Medical Director for Behavioral Health of the Providence Health Plan, and I'm also the co-chair for the Zero Suicide Focus Group of the Behavioral Health Leadership Council. Today I'll be talking to you about zero suicide. Suicide is a serious public health issue, and suicide rates have sadly been increasing in this country. As a healthcare system, we have an important role to play in suicide prevention. At Providence, we may encounter patients at risk for suicide in all of our settings, whether it's in our hospitals, clinics, or emergency rooms. So it's imperative that we have the necessary tools to identify patients at risk for suicide and the skills to work with them to mitigate that risk. Zero Suicide began as a depression care quality improvement initiative at Henry Ford Medical Center over 2 decades ago. During that time, leaders there identified suicide as a critical area of focus, and they developed the aspirational goal of obtaining zero suicides. This approach has caught on and is now considered a best practice that has been adopted by numerous healthcare systems across the country. Zero suicide is a clinical framework designed to optimize the care of patients at risk for suicide. At its core, zero suicide is a set of evidence-based clinical approaches that have been shown to reduce suicide behavior. Key components include screening, safety planning, and suicide-specific care, such as Dialetical Behavior Therapy, or DBT. Zero suicide is consistent with the goals of a high-reliability organization because it focuses on the system and not on individual caregivers. The goal is to embed key clinical pathways that are skillfully and routinely delivered. The right care at the right time, every time. By implementing zero suicide as an organization, we can make a difference by preventing suicides among those we are honored to care for. Thank you very much. And now I'll be introducing Howard Munn, my co-chair on the Zero Suicide Focus Group. He'll be discussing how Providence plans to implement zero suicide.
Hello, I'm Howard Munn, Director for Clinical and Quality Governance with Physician Enterprise. Every day in our work, we are faced with those under our care who are contemplating life and death. And we understand that the pressures in delivering care for these patients can be stressful and overwhelming. We also know that our caregivers may not have the needed training and tools to deliver highly reliable, efficient, and the care that our patients need in their moments of crisis. Please take a moment to think about how prepared you are when a patient expresses thoughts of harming themselves. How confident are you in knowing what to do in this situation? To help you in navigating through this challenge, a system focus group was formed in 2019 to bring together subject matter experts across Providence to gather ideas, best practices, review the zero suicide framework and recommendations, and collaborate in developing the initial set of guidance, tools, and training to help you in caring for your patients. Providence has chosen to focus on tackling 3 key areas: suicide screening, assessment, and safety planning. These areas were selected based on a year-long assessment of care needs of the organization and discussions with regions to learn about the real struggles in delivering suicide care. The developed Providence Zero Suicide Toolkit is a 3-pronged approach with just-in-time tools and guidance to better prepare you for conversations with your patients and increase your confidence. The first prong focuses on a simple set of clinical recommendations in the identification, assessment, and safety planning for patients with thoughts of harming themselves. The second is a set of EPIC tools to ease your way in documenting the assessment and safety planning. It will also include recommendations for patient-facing digital tools that could be provided to patients. And lastly, a series of short training videos developed by our own Providence caregivers who will lend their expertise and insight on how to use the guidance and tools in your practice. With future phases of our work, we'll work to refine the guidance for specific populations, bolster our training efforts, leverage technological solutions, and include elements such as means reduction, caring contacts, and connections where there are community resources. We are hoping that the set of initial deliverables will be of value to you, your patients, and help save lives. At Providence, we are dedicated in easing your way in caring for the poor and vulnerable we serve. Thank you for your time and attention.